Aloha. Welcome to Hawaii Care Choices Healthcare Talk Story. I'm Tish Lopez, your moderator this morning. Thank you so much for joining us on this beautiful Aloha Tuesday. Before we get started, we want to let you know that today's Zoom meeting is being recorded so that you and others may access it in the future. All of our presentations are available on our YouTube channel simply by searching Hawaii Care Choices. For those of you joining us on Zoom webinar, the bottom of your screen should look like this. Please click the chat box and say aloha to everyone here and let us know where you are joining from. I know a few of you got started a little earlier, so mahalo for initiating that. Healthcare Talk Story is now an interactive presentation. We will be asking you questions throughout the presentation, so please use the raise your hand button and send us feedback. Lastly, please click on the Q&A box at any time to submit your questions to our panelists. To those of you watching on Facebook Live, thank you so much for joining us, and aloha. Please use your comment box to chat aloha and let us know where you're joining from. Feel free to chat in questions as well as share your reactions with us during the talk story using those buttons. We love to see those hearts and thumbs up and even the care button. This talk story is also an interactive presentation for you. So please put your answers right there in the comment box. We will also be doing polls today. For those of you watching on Facebook Live, you will not see the polls pop up, but I will read them out loud and you can use that comment box to submit your answers. Everyone is welcome to join in the fully engaged Zoom presentation next month. Just email me at llopez@hawaiicarechoices.org and I will send you the link. Now, polling is very simple. Question will pop up on your screen similar to what you see right now. Please make the selection that you think is best and submit your poll using the bottom button. There's no right or wrong answers. We just want to see your feedback. Just to kick things off and get you comfortable, let's try an icebreaker. So up on your screen right now is the question, if you could be one of these mythical animals, which one would it be? A dragon, a unicorn, a mermaid, or a sphinx? Again, for those of you joining us on Facebook, if you could be a mythical animal, which one would it be? A dragon, a unicorn, a mermaid, or a sphinx? Choose your best answer and click submit or type it in the comment box below. All right, we're going to go ahead and end our polling there and share our results. So 20% of you said dragon, 30% said unicorn, 30% said mermaid, and 20% said sphinx. Wow, we got a tiebreaker between the two of them. Awesome job. That's it. So easy, right? Thank you so much for joining in our polls. Let's check our Facebook. Oh, we got one of you on Facebook. Thank you so much for joining us. Now, I would like to introduce you to our speakers today. We have Lonnie Weigert, Community Relations Manager for Hawaii Care Choices, and our wonderful presenter on all of our presentations. If anyone has heard Lonnie speak before, please send her a comment or a chat and say hello and give her some hearts. Aloha, Lonnie.
My friends. Hi, aloha, everyone. Good morning. Thanks so much for joining us.
We also have another guest speaker this morning from Hawaii Care Choices, Palliative Care Registered Nurse, Jason Buckley. Aloha and welcome, Jason.
Yay.
Aloha, Tish. Good morning, everybody.
Good morning. This morning's talk story, we will have Lonnie Weigert answering a big question. Can I have curative treatment together with palliative care? She will explain how palliative care could boost your quality of life, reduce stress, and help your loved ones to live well. Next, we will have Jason Buckley, palliative care RN, explain what it is like to have palliative care, the team that supports you, and the many benefits and care options to patients and families dealing with cancer, CHF, lung or kidney disease, and more. I am so excited for all of you to join us right here on Healthcare Talk Story. All right, friends, here we go. Our first presenter this morning, Lonnie Weigert. Please give her a virtual round of applause as we listen and learn how palliative care could boost your quality of life. Aloha, Lonnie.
Aloha. Yay. Thank you. Hi, my friends. I'm so excited that you folks decided to join me this morning. So let's get after it. We have a lot going on. So there's oftentimes people hearing the words palliative care or hospice care, or maybe no one has heard it at all. So I just want to share with you that there are some differences. First of all, palliative care, you're going to start to hear that word or that term quite a bit. And it's because it's a very, very large umbrella of specialized care. In fact, hospice care is a subset under palliative care. And normally it is the highest level of care that you can get once somebody transitions to hospice care. So let me tell you really quickly the difference between the two. So palliative care really focuses on relief of symptoms that are caused by treatments such as chemotherapy, radiation, surgery, dialysis, and also it is a type of relief that people seek when they are dealing with a serious illness such as cancer, kidney, or lung disease. It's really a specialized type of care, and not very many people will ask for it, largely because they don't know of it. Now, going up the journey scale here of the illness journey, we see hospice care. Hospice care also is under palliative care. However, it is more at the end of life. When somebody comes to hospice care, it really is all about focusing on keeping them comfortable and really living life as they would want to, meaning surrounded by loved ones, doing things that bring them joy. It's that kind of thing where hospice care comes in, and there's no more treatments at that point. No more treatments. People are just focusing on staying comfortable, and we are there to help them. There is a need for a doctor, primary care physician, to give his or her best 6-month guesstimate so that a person can qualify for hospice care.
All right, friends, we are in our interactive presentation. So if you understand about you understand that palliative care focuses on relief and hospice care focuses on comfort, give me a thumbs up or raise your hand.
Yay! Okay, awesome. Are we seeing the results from this, Tish? Or
Yes, we are. Thank you so much for raising your hand,
Okay.
friends.
Okay. Okay, while you're pulling that up, I'm just going to get right on this one, which is how is palliative and hospice the same? So I just shared with you the difference, but now I'm going to tell you how they both are quite similar. So first, both types of care relieve suffering. Both types of care can be delivered in a patient's home, wherever they call home. Both can be delivered with a plan of care or goals of care. And we'll talk about goals of care a bit more as we continue on. And both can improve the quality of life for both the patient and the family.
Raise your hand if you think palliative and hospice care improves quality of life for patients and their families.
Thank you, Tish. Okay, so Tish, when we have the polls up, you can just go ahead and put it up at any time.
Okay,
and I'll
sounds
just
great.
stop just so that people will see what kinds of responses that we're getting. All right, coming here. Now, how are the two different? Well, I told you in the beginning that the two are slightly different because of the emphasis. One was focused on relief, one was focused on comfort. Now, here are the specific differences. So palliative care, it serves those with a serious illness, which is also those on hospice. However, this one is going to really provide care for those who are having curative treatment. So that's really where the rubber hits the road on division. So people on palliative care are normally seeking curative treatments. And what many people had no idea about is that you could be of any age. And so even young babies could be on palliative care. They're dealing with a serious illness. We are able to provide that care. Now, hospice, the difference with hospice is it requires a 6-month life expectancy or best life guesstimate by the primary care physician. And that is the really deciding factor on whether somebody qualifies for the highest level of care there is. By the time somebody is on hospice care, or if they qualify for hospice care, they no longer need to keep doing any type of curative treatments. By then, it's all about focus. It's all about comfort. It's all about having joy with their family.
All right, friends, we're asking if give me a yes in the chat box if you know someone that could benefit from hospice or palliative care. Wonderful. I see those yeses coming in our comment box. Thank you so much, everyone. I am going to put our brain teaser up on the screen now. How is palliative and hospice care the same? Both relieve suffering, both can be delivered in patients' homes, both improves the quality of life for patients and their families, both creates a plan of care, or all of the above. Again, for those of you watching on Facebook Live, you will not see the polls pop up, but we still want to hear from you. So feel free to put your answers right there in the comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month. Just email me at lopez@hawaiicarechoices.org and I will send you the link. All right, we're going to go ahead and end the polling right there and share the results. So 100% of you said all of the above. Awesome. Thank you so much. Back to you, Lonnie.
Thank you. Thank you, Tish. Oh, I just love it when the group is just so on top of it. Oh, that is just so wonderful. Okay, let's continue. And I'm really glad because we're going to be able to drill down quite a bit more because we have Jason Buckley on this call, which there'll be a lot more discussion about really going into different levels of palliative care. So signs that palliative care is needed. First of all, the reason we like palliative care is because it tries to reduce the amount of times that people have to go to the emergency room, that they're having to take so much more medications than normal. And when I say more medications, I'm talking about somebody that's taking, more than 20 different prescriptions in a day. And also, it's great when you have palliative care and you get that support, you have more strength and focus to do a lot of the normal activities of daily living. Once we see that that's difficult to do, such as managing finances, driving, going to the grocery store, preparing meals, and even light housework, then that is definitely an indicator that maybe palliative care will be for you or your loved one. And of course, the ongoing pain, fatigue, swelling in the feet and legs, nausea, these are signs that are hard to avoid. You just can't keep putting them off to the side. After a while, it just starts to feel chronic. So palliative care is definitely time to come in and support the patient and family.
Friends, raise your hand if you know anyone who is visiting or calling their doctors frequently.
Thank you, Tish. So when should palliative care begin? When we talk to our medical director, Dr. Dolan, she will always say at time of diagnosis, and then to stay with palliative care throughout the course of the illness. We have found, especially from those who have lost loved ones, that they absolutely wish that they had called us earlier. And it's because the quality of life just starts to stream out, the side when somebody doesn't know that palliative care could help them. By signing up early, we're able to help people really live fully in whatever they do in their life. And oftentimes, because they don't know or they're embarrassed or whatever they think, they don't call us. But I tell you, it should begin at the time of diagnosis.
Friends, by signing up early for those with serious illness could live longer, please type true or false in the comment box.
Oh, I see your answers. Thank you, everyone. Thank you. So when somebody like Jason or even our nurse practitioner comes to the home, we're going to ask some of these questions. And the reason I share this with you is so that you can kind of get an idea of how palliative care feels when we come over to your house. So we would ask things like, if you understand about your illness. It is amazing to us how many times somebody has a serious illness, but no one has ever explained to them what that illness is, what to expect, how the journey is going to go. And we like to really, as part of our core care, is to provide education. The other thing is we want to know who is going to be making the medical decisions. Oftentimes the patient is, but then many times they want, somebody else within their family to also be weighing in on that as well. We want to know what's important to you and the family, and that is something that we'll cover more about in goals of care, and we'll bring that up to our RN, our registered nurse, Jason, because asking people about their values, their priorities, really helps align us up to their treatments. So we would never want people to have treatments that they don't actually really want, or they don't understand why they're getting. Believe me, it happens way more than we ever want to admit. And palliative care makes sure that there's a stop to that. Also, it's important for us to know, like within the household, if there's certain things that are going, like maybe there's Bible study every Wednesday, we would like to know that so that we can come and support the family and the patient to be better prepared for things that are important to the family when something is happening in the household on a regular basis.
All right, friends, is it important for you to understand about your illness? Please type yes or no in that chat box or the comment box on Facebook.
Thank you, Tish. Okay, so medication review. So you see this couple over here with all these jars of pills. Okay, this is no joke. We go into homes and they'll bring out, the old plastic Walmart bag that nobody has anymore. But anyway, it's filled with pills, and all of these jars are all in there. So once they put it out on the coffee table and they show us, there could be more than 50 different jars of pills. And the reason that is I mean, there's a good amount of it that's expired, but they don't throw it away. Some of it, belongs to the deceased ex-husband. Some of it belongs to adult children that no longer live there. And then some of it belongs to them. So what happens though in palliative care is our team will come in there, our registered nurse will come in there and help take a look, review all of this medication. Maybe a loved one or yourself is taking, 20 different medications during the day. But after a review is made and the primary care physician is looped in, then a recounting of what is needed is then brought forth to you. And the reason this happens right here with all this medication is because sadly within the medication tracking system, there isn't a global one yet, where if you go to your primary care physician, you will get medication. If you go to urgent care, you'll get medication. If you go to the emergency room, you'll get medication. If you go to whatever ologist, your cardiologist, etc., you'll get medication. Nobody is checking or cross-checking the other one, and that's why you get 50 jars of medication like this. So know that palliative care, when the team comes in, will help get it all together, and will even help you fill the pill finder right here, because that is really how we can keep everybody on track.
All right, friends, if you think medication review is important, please raise your hand.
Thanks, Tish. So other services that happen with palliative care, we have an incredible social worker that comes in with the palliative care team. And she will help connect not only the patient, but the family to community resources that will help support the family. And an example of that could be the food basket. Maybe the family could use some supplemental food during the month, and we're able to do that. And there's so many other resources that we're able to connect the family with. The other thing too is we're able to help the family with filling out a lot of forms, like insurance forms. Maybe the patient does qualify for Medicaid, and we're able to come in there. Our social worker is extremely talented, and she will be able to do that. Another part, which I'll talk about a bit more going forward in the presentation, is the completion the completion of the advanced healthcare directives. When a poll was put out, 85% of the people would say that it's very important to have an advanced healthcare directive, although only 35% of them actually had one.
Friends, do you think these additional services increase the value of palliative care? Type yes or no in the chat box or the comment box on Facebook.
Thanks, Tish. How is palliative and hospice care paid for? So for the most part, palliative care is paid for under the universal insurances, and it's only paid for on specific types of the care, meaning whenever the nurse practitioner comes to visit, then that is just like a doctor's visit. So we're able to bill that off, and that could be a copay of anywhere from $12 to $25, depending on what the insurance is. Also, whenever the licensed social worker comes, there could be also a copay on that as well, just like a doctor's visit. However, for those who have other additional insurance coverages, the copay could be covered under there. I know for sure that those who have both Medicare and Medicaid will have no charge at all to receive these services on palliative care. For hospice care, it is primarily covered under all insurances, including Kaiser and Veterans Administration, for those who receive hospice care at home. It is 100% covered.
Friends, raise your hand if you understand how palliative and hospice care is paid for.
So further on in the presentation, when we have our registered nurse on, we will cover why the current insurance companies across the board do not cover palliative care. Please stay tuned for that, because I'm going to bring up that secret coming up. So why hospice care? Well, first of all, hospice care focuses on the quality of life versus the quantity. Now, that is something else that our registered nurse, Jason, will be covering as well, because a lot of times people will do a lot of heroic curative treatments to stay alive, yet the quality of life will just diminish. And that is where the goals of care come in, where we make sure that our compass is going north all the time, meaning we are staying in alignment with whatever the patient needs. And I want you to know that sometimes the patient goals could differ from the family goals, but we have seen many, many times on how people will go after quantity versus quality, and to the price of really diminished quality of life. So people will say, well, what's the big deal with hospice care? The big deal with hospice care is that it was created to reduce and ease terminal suffering. That was really what it was about. Death is not a requirement. It is not a requirement on hospice care. So that's why when people are misinformed on no, hospice equals death, there couldn't be a bigger misinformation than that. So that's definitely a myth. The other thing is when hospice comes in, it really redefines hope. Oftentimes people will think I'm giving up hope if I go to hospice, but that's absolutely not true. Hospice comes in and is able to redefine hope on what makes the difference to the patient. You know, is it listening to the guitar music that they had written, years before? Is it taking that car drive past the beach because they remember that was their favorite fishing spot? Those are the kinds of things that really come into the forefront when hospice care comes into the home. And obviously, when hospice care comes in, it is the highest level of care, the Cadillac of all services that anyone could have. Once that happens, hospice care comes into the home, and it is actually a very beautiful thing.
Friends, let us know in the chat or comment box if quality or quantity of life is what you want for your loved ones.
So it takes a village, my friends. It absolutely does. You know, on the palliative care team, there is a nurse practitioner, there is the registered nurse, there is the licensed social worker. That's it, 3. Okay. But on the hospice care side, because you are at the highest, the absolutely highest level of care, look at the team. Look at the team on your screen that comes in to help. And so it is because we are providing, like I said, the highest level of care, and we're coming in to help those who are no longer seeking any kind of treatments. They are terminally ill. We want to keep them as comfortable as possible. And we have things in our toolbox that nobody else has. I'm talking about including your primary care physician. So if you want the expert care, then you need to call the experts. And that is where Hawaii Care Choices comes in. And also, again, like I told you, every time when we talk to a patient's family, the first thing they say is thank you. And the second thing they say is, I wish we called you earlier. So do not hesitate. Even if your doctor didn't tell you, if you think that, you know, mom or dad or auntie or whoever is not looking good, call and make the action happen. I found now that, you know, before 15% of the community would actually call in and take action on their loved one with their doctor. 85% is doing it now. And that's because you guys are all so much smarter. So again, call the doctor. Do not wait around until mom can't eat anymore. Like, get on it right away so we can come in and help you. And especially if you are the caregiver and you are getting completely burned out, you can't even remember whether you ate or not. I mean, it's getting to the point where you hardly even sleep and you're not even brushing your hair maybe. Definitely call us, because that means you need a lot more support in the home. And that's what this expert team is going to bring you.
All right, friends, raise your hand if you think early patient sign up ensures more support and quality of life for all. All right, my friends, there is the brain teaser up on your screen. And the question is, early patient sign up ensures more support and quality of life for all, true or false? For those of you following us on Facebook Live, you will not be able to see the polls pop up, but we want to hear from you. Feel free to put your answers right there in the comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month. Just email me at llopez@hawaiicarechoices.org and I will send you the link. All right, I'm going to go ahead and end our poll right there and share the results. So 100% of you said true. Early patient sign up ensures more support and quality of life for all. Thank you so much. Back to you, Lani.
Thank you so much, Tish. What is awesome is all of you that are on this presentation right now, you guys know the truth. It makes no difference if you don't tell anyone, okay? So today, at least tell 3 to 5 other people that you know this, all right? Because the heartbreaking part of all of it is when we see it happening again and again and again. It's like, how come they don't know? Believe me, I will never stop screaming this from the rooftops, but I'll need your help, okay? Go out and please tell at least 3 to 5 other people the truth that you are hearing here today, please. So when is it time for hospice care? Okay, this is what you'll see if you have no medical background at all, and that's totally me too. So, you know, if you notice that you or your loved one is having to go to the emergency room a lot more or losing a lot of weight, and like a lot of weight is not like 10 pounds, it's like 20, 30 pounds, you start to notice, you start to see the bones coming through. That is definitely time. Also, there's an increase range of falls, and that's because a person is losing their balance, they're becoming quite frail, they don't really want to eat, so they're losing their strength as well. They don't even want to drink anything too. They want to sleep most of the time. They don't even want to get out of bed or even sit up. They have difficulty even getting out of bed or lifting themselves out of a chair. That's definitely, all of these signs are clear signs that somebody could use hospice support at home. And also you can notice on the skin, there'll be a lot of different infections, not only happening on the skin, but all through the body. So please be watching for these kinds of things and don't wait. Call us and we can help you. If your patient or loved one is not ready for hospice, they may very well be ready for palliative care. And it's better to get them that access to care as soon as possible.
All right, friends, Lonnie asked for your help in sharing this news. If you are on Facebook, please share our Facebook live feed or share our flyers to all of your friends. Lonnie, I do just want to say one of our friends joining us did share our feed to their entire friends. And this person said it's definitely more than 3 to 5. I'm assuming it's 100 or more.
That is awesome.
So thank you so much.
You guys rock. I love it. I love it. And tell more of your friends to come on the presentation because we'll have it again next month on the 10th, on May 10th. So definitely have everybody come on so I can let them know too.
Yes, absolutely. Friends, now I would like to share with you a personal story from our patient caregivers.
Every single person in Kupu Care was like an angel. They were right on. They helped me. And then when it got really bad, so the doctor finally acquiesced. But the doctors, I think, take too long to plug people into the home health care they need. He got hospice finally, and he was with them almost 2 weeks, and then he passed away. But I could have used them way before. And people need to be informed, by the doctors about Kupu Care so they can get them plugged in to the help they need. Otherwise, they're going to be in the situation I was in, which was pretty intense for quite some time. Thank God for Kupu Care. And all the people in hospice were angels. They were wonderful, beautiful people, beautiful, so supportive.
One of the reasons why we went to Kupu Care was that my husband had found out that his illness was probably going to be progressive and not curable, so he was a little anxious and so was I. During that time, after he was diagnosed, his idea was spend as much time with the grandchildren so that they would be able to, remember. He had spent a lot of time with the community and, so he wanted to spend more time with family. And I think Kupu Care allowed him to do that. As far as quality of life goes, I think it was exactly what my husband, Barry, wanted.
Thank you so much. So as you can hear from both of those ladies, that Kupu palliative care really made a difference for them. And then of course, they had wished that for hospice care that they had gotten it early. But really for both, if you can get, your loved one or anyone that that could benefit, please do not hesitate to call us because the difference is really night and day on trying to get somebody the care that they need, and especially the entire family. So why is an advanced healthcare directive important? So first of all, you need to have somebody, a trusted agent or somebody that can voice your wishes in the event that you are unable to. We see it happen at the hospital all the time where some unexpected occurrence happens and then the family is up there fighting amongst each other because their loved one did not create a advanced healthcare directive, and one is saying no, mom would never want that, and another is saying no, yes, mom would want that, and then it just goes on and on. So there couldn't be a better gift than the advanced healthcare directive that is done for your loved one. So again, like I said, although 85% of the people surveyed believe that this is necessary, really only 35% of them had one. So please don't be one of those. You only have to be 18 years or older to get one.
And friends, we want to ask if you could please type it in the chat box. Do you have an advanced healthcare directive? Type yes or no in the chat or comment box.
Okay, so here are my friends with Hawaii, Community First that does these wonderful online and in-person presentations on getting your advanced healthcare directive. What I love about them is they really do this presentation in an easy to understand type of way where when you leave, you actually got the paperwork to do your healthcare directive, and they even make copies for you if you go to the in-person one. So here are the other dates, the remaining dates so far up to June, but they continue give the updates on further dates out for the year. So this is an incredible group. Like I said, this gift of an advanced healthcare directive to your family is free, but it's probably going to be the most precious gift of all. So go ahead and give my friends right here a call, or just put your phone up to this QR code and go directly to their contact page.
Friends, I'm also going to be adding their information in our chat box now. So feel free to go ahead and copy and paste that right into your next internet tab.
So sometimes people will ask me about a POLST. So the POLST means physician's order for life-sustaining treatment. And it's normally this green form. Some of you might see it. Some of you may never have seen it. But I just want to tell you really quickly, the difference is that this is an order, a physician's order. The Advanced Healthcare Directive is really a direction that somebody is giving you. So there is a significant difference, meaning if EMS comes to your loved one's home and they're going to be whisked off into the ambulance, if this is on the refrigerator, they'll take it and they'll follow it. So be sure to know that this is a very important document. However, not everybody has this. I mean, somebody that is seriously ill or very frail will probably get one from their physician, but no, like everybody on the road is not going to have a POLST. I'm just letting you know that there is a distinct difference between a POLST and an advanced healthcare directive.
Friends, if you understand the difference between a POLST and a healthcare directive, please raise your hand. Awesome. I see those hands being raised. Thank you so much. I'm going to go ahead and launch our last brain teaser, Hanaho. The question is, where do I get my free advanced healthcare directive completed or updated? By registering online, by calling, or all of the above? Again, for those of you watching on Facebook Live, you will not be able to see the polls pop up. We still want to hear from you. Please feel free to put your answers right there in the comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month, May 10th at 10. Just email me, lopez@hawaiicarechoices.org, and I will send you the link. I also want to say thank you so much for everyone who does have their advanced healthcare directive. Many of you chatted, yes, you do. So I'm so happy that you do. I'm going to go ahead and end the poll right there and share the results. 100% of you said all of the above. Awesome. Thank you so much for joining us, or excuse me, for participating in this and for joining us. But thank you so much. Back to you, Lani.
Thank you, Tish. Greatest gift, the greatest gift ever is that advanced healthcare directive. So be sure, if there is somebody you know that doesn't have one, just get after them gently, of course. All right. So let's see. Pohai Malama Care Center. So for those of you who know about this, I mean, this place is like the Mauna Lani of hospice, and it is clearly a community asset. So we are very, very proud of it. People go here when we cannot manage their symptoms at home. So people who come here are on hospice care. This is not a long-term care facility. People will come here normally if they can't control their symptoms at home, or if they are actually in the active dying zone with regard to end of life. Normally those who have a Medicare insurance, the hospice portion of this will be covered. Those who have Medicaid, the room and board will be covered. On those who do not have Medicaid or additional insurance, we do offer private pay as well.
Friends, please enjoy this short virtual tour of Pohai Malama.
Welcome to Hawaii Care Choices Pohai Malama, a Harry and Jeanette Weinberg Care Center. This is a state-of-the-art short-term care facility designed to feel like the most beautiful home you've ever been in. A spacious living room to gather your entire ohana together. The meditation room provides a beautiful space overlooking the gardens to find solace in quiet contemplation. Nothing feels more like home than gathering the family for dinner around the TV, which you can do in the family room while the keiki play in the room next door. Each suite is designed for maximum patient and visitor comfort with sleeping areas for guests, private bathroom facilities, and each room even comes with its own private lanai overlooking the lawn and gardens. When you or your loved one are in our care and you need some extra care, there's no place like Pohai Malama. For more information, call us at 808-969-1733 or visit us online at hawaiicarechoices.org.
So this is the area that we cover. All the areas that are colored, it is from Lapahoehoe Point all the way to South Point Road in Ka'u. We cover all of that, which is half of this very, very big island. And our mission is really always to improve the lives of those we touch by offering support, guidance, compassionate care of body, mind, and spirit. And this is not only for the patient, but for the families as well. In fact, we do it for our entire community, and it's such an honor.
All right. Thank you so much, Lonnie, for your explanation on palliative care and how it can help. Thank you, everyone who engaged with us. I hope you all have learned something today, and I hope you share it with your friends and family as well. Just a friendly reminder, if you have any questions for Lonnie or for Jason, please feel free to put it in that Q&A box down below. All right, moving right along in our talk story. On this beautiful Tuesday morning, we will switch gears to hear from our guest speaker, Jason Buckley, Palliative Care RN at Hawaii Care Choices. Aloha, Jason.
Aloha, Tish. Good morning, everybody.
Good morning. Thank you again so much for joining us. Can you start by just please sharing the difference between a registered nurse that does routine care versus a registered nurse that does palliative care like yourself?
Absolutely. So hospital-based care is and routine care is more focused on a very specific care plan. There's not a lot of flexibility. It's physician-driven. It's medically driven. So based on medical necessity, the patient kind of gets put into an algorithm and care is delivered. It's not necessarily a cookbook or a recipe, but it can be taken from that. If someone has a low potassium, you're given orders to replace the potassium with a certain amount and a certain quantity and draw labs again at a certain time. And the artistry of nursing is kind of interwoven somewhere in between that in terms of developing relationships. In palliative care, the emphasis or the onus is more on the artistry of nursing, where you get to develop the relationships, and the plan of care is developed on what the patient finds important rather than what is deemed to be of medical necessity.
Okay, wonderful. Are patients able to continue with curative treatment such as chemotherapy, radiation, dialysis while receiving palliative care?
Absolutely. We support our patients in pursuing whatever is important to them, whether it is, they see quality in spending more time with their family. If they see quality in getting out of the ocean, help the patient get down to Pahoa Pool because he just loved being in the water, and that was super, super, super important to him. All the way to if people want to get lung transplants, kidney transplants, liver transplants, open heart surgery, transcaval TAVR, whatever it takes to help people reach whatever their goals are, we are part of the team to help them get there.
Awesome. Awesome. I mean, you mentioned a few things, which goes to my next question. Why is it so important to have palliative care alongside these treatments?
Absolutely. So from my experience working on both sides of the continuum, I spent a lot of time working in the cardiac cath lab, doing interventions, helping people with heart conditions. Worked in the coronary ICU, so I saw the outcomes of these treatments, and I can speak to people about what they may anticipate experiencing. And on the other side, I'm able to go to doctor's appointments with patients and help them kind of decipher everything they get. I see a lot of people going to appointments and going through the care algorithm, and they're just bewildered. They have a new diagnosis. There's new language coming at them, words they've never heard, like mesothelioma. Like, what is this? What does this mean? Stage 4 cancer, adenocarcinoma, congestive heart failure, mitral valve prolapse. What does this mean for me? What does this entail for my life? And we help them, we take all the information afterwards, we decipher it with them at a pace that they can comprehend, and we unpack it. And then they can make their choices from there about what they want to do.
Okay, wonderful, wonderful. Again, you touched on just my next question. Are there, including what you have just said, are there any other benefits of receiving palliative care really early in a diagnosis, other than what you just shared too?
I think it's the same benefit that folks get when they move in with a hospice team early in their diagnosis, is that you get to develop trust and rapport. One individual that we've been working with now for a long time, well over a year, has advanced COPD. We've gone to his house multiple times, called EMS for him. He's been intubated, and we've helped him. And whenever he doesn't feel well, he calls us because we developed that trust. We met him early on in his disease process, and we are his go-to. And it's really a privilege to be in that position. So, and it's the same thing when people decide to move with whatever medical team they choose to pick up, whether it's hospice or oncology. You develop a relationship with that group, and the trust is built through consistency with that entity.
Wonderful. Tell me about a little bit more about that relationship. If you can please explain what you do when you visit a patient at home versus when you accompany the patient to their doctor's appointments.
Generally, I like to visit people at home before I go to the doctor's appointments, but that's not always the case. Coming into people's homes, generally just try to listen. I try to use all of my senses to appreciate what the person's life is like. What is their home? What do they cook? What is, their animals, their pets, their people, their family? What's important to them? And I just try to observe and listen and try to hear them and understand what they're feeling. And based off of that, then kind of taking the medical information into account, start providing them with feedback that seems relevant to what's important to them. When we go to doctor's appointments, it's a lot like a football game. We huddle beforehand. We talk about, what's the goal here? What's the strategy? Who's on the line, and what are we going to talk about? What information do you want out of this appointment? What is your goal? Do you want to find out, what stage your cancer is? Do you want to find out what options you have for treating this valvular regurgitation? What do you want to know? And we often go into doctor's appointments, and we just milk those appointments for all the richness that they're worth, because those physicians have so much knowledge, but without the right set of questions, often a lot is left on the table.
Wow. Okay. So Lonnie touched on it.
Expand on that. So Jason, can you, thanks for giving us like the general look of how the doctor's visit could be. Can you give me an example of one that you went to recently where, having them focus before you go in, meeting the patient and their caregiver, and then going in and then coming out with a positive outcome? Is there any that comes to mind for you?
There is, Lonnie. I'm really blessed to work with one particular family. The patient has a adenocarcinoma of the pancreas, and the patient had a really difficult experience with chemotherapy that landed her in the hospital following her first round for about 5 days. And on discharge, she was disillusioned with the system. She was done with chemotherapy, wanted to say enough already, and met with the patient, met with the family, kind of help them size up what's important to them, and spending time with family and having more time, having a more life to live is very important. So based upon the medical notes, it seemed like there may be some options. So I met with the family at the oncology center. We sat down together in the lobby, and I spoke with this individual, and I asked a series of questions. Do you know what stage your cancer is? Do you know if this chemotherapy is being delivered with curative intent or palliative intent? And the difference is that if it's curative intent, that means that there's a good chance that this cancer, if they follow the course of treatment, can go into remission, versus palliative is just kind of giving chemotherapy endlessly to try to keep the cancer from spreading. And the last question I asked her was, would you be willing to consider continuing chemotherapy if the regimen could be reduced, meaning that they were giving her 100% chemotherapy. If they reduced it to 60, 50, so there's less side effects, would that be something that she'd be willing to entertain if everything else lined up for her? And she said, yeah, I think I would. So we went into the doctor's office, and we're sitting there, and the doctor walks in with a white coat, sits down, and we start kind of going back and forth, and we find out, wow, so this cancer hasn't been staged, and it's just located just in the head of the pancreas. And the intent of therapy for this chemotherapy is curative. There's a really good chance that if she can do this round of chemotherapy, perhaps radiation or surgery after, that she can be in remission and have normal life. Wow, that was a game changer for her, because she could see for the first time with clarity that there's a light at the end of this tunnel, that it wasn't going to be endless chemotherapy, that it wasn't going to be hospitalization, that there might be a tough patch, but this is something they can get beyond. And so the pain that she was experiencing, the doctor asked if our nurse practitioners could prescribe for her and to help her manage her pain. And that's what our nurse practitioners specialize in, is pain management and symptom management for folks with symptoms related to their diseases. So her pain is better managed. Her chemotherapy has been reduced, and she just had another round, and she's feeling great. And the family's excited, and things are moving forward in a really good direction.
So, Jason, what are the percentages of these visits that you go on where you ask the question, is this, curative versus palliative? How often are you told that, in fact, it's curative?
Probably, I would say a majority are palliative. And then if that's the answer that we get, which isn't a bad answer, it's important to understand what palliation means in terms of treatment. And then in terms of, and this applies more specifically to oncology, but it's important to understand what palliative treatment means in terms of long-term expectations regarding chemotherapy side effects, goals of care, and quality. Because some chemos can be rather benign in terms of their side effect, and some can be rather harsh, and helping the patient to unpack that, what that means. So, but there are plenty of cases where there is curative intent with treatment. Absolutely.
Wow. So can you tell me, do you believe that your presence there to articulate this to the oncologist made the difference in communicating this to the family?
I imagine so. I'm sure it helped. That facilitated.
Oh, you're so humble. I know for a fact that most people don't understand the terms or the language, in which to really hit the target with the oncologist, who, like you said, is filled with so much knowledge. But because the question is not crafted properly, they will not just offer that information up freely without the family actually knowing. So, wow, that is a huge triumph. So then, did it follow up with a family meeting?
It did. The family met independently together and chose their course based upon the patient's will and desire. And then our nurse practitioner and social worker met with the patient and family. The social worker helped solidify, because you alluded to this before, Lonnie, that sometimes the patient may want something and the family wants something different. And when those fractures occur in families, it's really, it can cause a lot of intergenerational pain and strife. And our social worker is fantastic at helping to bridge those gaps in perspective and bring people together. And then our nurse practitioner was able to go in there and assess the pain and come up with the best regimen to keep her comfortable during the duration of her treatment.
That is awesome. Which actually brings me to my next question. Again, Lonnie touched on it. I think you touched on it, but what does it mean to have a goals of care plan? I know that goals of care plan was said a few times. Can you just explain a little bit more what that is?
Yeah, absolutely, Trish. A goals of care plan is, for us, is a plan that's based upon, it's patient and family centric, and it takes into account, it's like drawing a map, a roadmap to where they want to be. And we help them lay out the map and navigate the course to get to what their desired destination is. And if there's detours along the way, or even if that point, that destination point at the end changes, we help them to navigate that course.
Okay, wonderful. And if you can tell us what other positions are on the palliative care team, I'm sure you're not doing this alone by yourself.
We have 4 different roles on our team. We have our administrative support staff in the office, Maka and Leisha, Kiana. They're amazing. They help get people organized with us, help us stay organized, and keep things running smoothly. They reach out to patients to schedule appointments. They take the phone calls and help us triage some of the issues that we get in terms of incoming phone calls. The next level is the nurse level, which is where I'm at. Again, going out to homes and helping, going to doctor's appointments, making phone calls. And then we have our social worker, again, who helps the families overcome different social issues. And then we have the nurse practitioners who go out and help develop these patient and family-centric goals of care and care plans, and help us adhere to them.
Okay, wonderful. That is a great support system and a great support team. If, a patient is going to their doctor and asking questions, but, the doctor just doesn't mention palliative care, can the patient and caregiver ask for it? I mean, how does that conversation start between patient and doctor?
Absolutely. Palliative care is for anybody living with an advanced illness. We have a subset of diagnoses that we work specifically with now. We're looking to grow, but right now it's heart failure, COPD, other lung diseases, CHF, I mentioned that, sorry, cancer, end-stage renal disease, liver disease. If anybody falls into one of those categories and they live here in East Hawaii, if they walk into their physician's office and they've heard of us and they would like to work with us, they can just ask for a referral and they can move forward.
Okay, wonderful, wonderful. I do have another question, and maybe this will apply to Jason, but maybe Lonnie can answer it as well. And this comes from our audience. What is the difference between a respite program at Pohai Malama Center versus the rapid relief program at Pohai Malama? Lonnie, if you could take that one. Sorry, Jason.
Okay, so the respite program, we're coming to provide support for the caregiver, and it could be anywhere from 3 to 5 days. The rapid relief also provides support for the caregiver. However, we're focused on trying to minimize or try to manage the pain symptoms that's happening for the patient. And normally that could take a few days. And that's the rapid relief program.
Okay, wonderful. Thank you so much, Lonnie, for answering that. Jason, back to you. I'd like to ask, why do you believe in palliative care? And if there are any patient stories that come to mind, or another patient story other than the one that you shared, that you would like to share with us today?
Yeah, my background working in ICUs and in cath labs, I was able to see, I was blessed to be able to participate and receive training in restorative and curative care. In the ICU in particular, I saw a lot of what felt like to me was suffering. People who didn't understand care choices, who at the end of their life ended up intubated and alone, with just the night shift to be with them, which is what I worked. I worked night shift, and it was really a eye-opening experience to see the medical system in that light, and to see that people really oftentimes may have chose something differently, or would have chosen something differently if they had known. So when this opportunity presented itself to kind of get out there early and to help people understand their choices, I jumped on it, because this is it's a calling, I think, or it's something that speaks to you if you feel it. So that's how I got involved. And patient stories, I mean, they're countless, they're endless. The people who are underserved don't understand. One person in particular really stands out to me. It's somebody who had a urogenital cancer, who was released from prison to a halfway home, and it was one of the most grotesque masks I'd ever seen. And he was in excruciating pain, and our nurse practitioners met with him, and they were trying to help him get his pain managed. And within 2 weeks' time, he was walking into Long's with a T-shirt on his lower half. It was just because there was no other clothing that was comfortable to him, and he had progressed so rapidly. And we spoke, and he spoke about his spiritual perspectives, and almost within 15-20 minutes, we were able to align his care options with what was important to him. And we were able to transfer him to Pohai Malama, where he received hands-on care. He got out of the halfway house, he was comfortable, and he ended up passing there, and he passed peacefully. And just feel so blessed to be able to provide that care to him and to other members of this community.
Wow, that is such a heart-touching story. Thank you so much, Jason, for sharing that. I know we talked about a lot of people who are able to receive palliative care and who should be asking for them, but kind of on the other spectrum, are there any people who are not able to get on palliative care? Maybe it's a diagnosis or, medical insurance. Are there a group of people that are not able to get palliative care? Can you please just share a little bit on that?
That's a really good question, Trish. So generally it's for people living with advanced illness. The American Oncological Society did release a position statement saying that anybody with any diagnosis of cancer, stage 1 through 4, should receive a palliative care consult. So anybody with cancer should receive palliative care. At this time in our community, we do not have coverage for people with neurological conditions, so Alzheimer's, Parkinson's, Lou Gehrig's disease, but that may be changing. I think that's it. Yeah. Most people with advanced illness qualify.
Okay. Talking about insurance companies, can you just touch on a little bit more of what insurances cover palliative care?
Pretty much all of them cover palliative care visits. Some require prior authorizations, but for the most part, it's pretty easy to access. And it's, maybe I'm biased, but I feel like if I had an advanced illness, I would definitely want to have this service in place. Again, I'm biased, but
I feel I am too. I might definitely ask for that as soon as the opportunity arises, really, because the support that comes along with palliative care is just really, really huge. Which brings me to my question: why isn't palliative care a standard option that's offered to patients by their doctors?
Palliative care is, from my experience, extremely misunderstood. Even as an ICU nurse, I didn't really understand the role of the palliative care nurse practitioners who visited. I always thought it was a paper tiger. And my appreciation for it grew over time as I understood the nuance of it. And I think the nuance of what palliative care is lost on the medical community as a whole, oftentimes. So I think there's a lot of PR that our organizations can do to get out there and to help people understand what it is that we do, that we're not hospice and that we're not necessarily curative treatment, but we are patient-focused, goals of care, symptom management, and and care coordination.
Okay, wonderful. Thank you so much, Jason. I don't have any other questions at this time. I just like to say mahalo so much for explaining all of these ins and outs of palliative care. We're so thankful that you took the time out of your super busy schedule to join us this morning. Are there any last comments that you'd like to share with our audience?
No, just mahalo for having me here.
Wonderful. Thank you. I believe Lonnie's having some internet issues, which is totally fine. I know she will echo my biggest mahalo again for you. And we hope you have a wonderful day. Thank you for joining us on Healthcare Talk Story. Aloha. All right, everyone, that was just amazing. If you had any other questions on palliative care, please send them out quickly and I can answer them on the side privately with Jason. But I also want to just say thank you so much for everyone that has joined us this morning on this Healthcare Talk Story. A very special mahalo to Lonnie and of course, Jason for their valued time and helpful perspectives that were shared today. If you have any specific questions about you or your loved one's situation, please reach out to us. We have a very helpful team standing by that will be happy to answer your questions. Just call us at 969-1733. You can also email us at care@hawaiicarechoices.org or ask your doctor if palliative care is right for you. Our hope is that you receive the right care at the right time. For those of you joining us on Zoom, there will be a quick survey that will pop up on your screen soon. Please make the best selection possible for all 6 questions and then click the submit button below. It is anonymous and it will not be shared. We would just love your feedback on our presentations today. Your input will allow us to gain a better understanding of how we can best serve our community with presentations like these in the future. All right, there is that survey popping up right on your screen. For those of you on Facebook, please send up your thumbs up or your hearts if you enjoyed this presentation, and please send a mahalo or thank you to all of our guests. All of you are invited to next month's Fully Engaged Zoom presentation on May 10th at 10 a.m. Just email me, lopez@hawaiicarechoices.org, or sign up on our Facebook page or join us on Facebook Live. I'd like to just add thank you so much, Lonnie, for a great presentation and on all of the palliative care and hospice care information. I know many have heard Lonnie speak before, and I'm sure I am not alone when I say it's always so informational. Lonnie, I was wondering if I could ask you a question while everyone is doing their surveys. Oh, I don't see Lonnie on the call. No worries. Let's see. I am wanting to go to Jason again, if I could, while everyone is putting all their answers into their survey. Jason, are you still on? Oh, perfect. Jason, a question that we always ask here, on Talk Story is the challenges that COVID posed to Hawaii Care Choices. Is there anything on the palliative care side? Lonnie shares it a lot, for the hospice side and the organization in general, but in specific to palliative care, what were some challenges that COVID posed to you and your team, and how did you guys kind of get over that or work through that?
COVID was a really unique experience from the palliative care side. I think, there's a few patients who ended up having COVID, and we were there early monitoring symptoms. We helped support them on their transition to the hospital because that's where their goals of care, that's what their goals of care was aligned with. We really felt lucky to be in position for early detection. I felt like we had great support from our organization in terms of personal protective equipment. So we were personally unaffected, or none of us were contracted COVID through exposure through work. So I think that it was a unique opportunity to provide home-based services like these. And
Yeah. Well, no, that is really wonderful. I know, for everyone, it has just been a challenge for the last 2 years. And I know Lonnie has mentioned before, in particular, that's why a lot of people wanted to get care at home. It was the safest place. It was the place away from a lot of people. And that Hawaii Care Choices provided that service, and also a safe service to all of the patients that came on our services. I have one more question that came in from Nick. He says, how can we working in other parts of health, or excuse me, how can we working in other parts of health and social care support the mission of palliative care?
That's a great question. I think it's just about getting the word out. It's about education. It's about, just having a conversation. Anytime people start talking about illness, or you're having dinner with a group of professionals, or whatever have you, and the opportunity to discuss palliative care comes out, and you can help professionals tease out that nuance and better understand the services we provide. That would be extraordinarily helpful. That way it helps propagate the understanding of what we do. When it comes to, the people of this community who are living with advanced illness, advocating for them, demonstrating, hey, listen, try this program out. It's worth a shot. And I guarantee you, once they experience what we can provide, they'll be blown away.
Yeah, wonderful. Is palliative care also appropriate or available to people who are in rehabilitation or skilled nursing facilities?
Presently, we only work with one skilled nursing facility. We're looking to expand to other care venues, but that's to be the date is to be determined for that
Okay.
rollout.
Wonderful. Well, that is definitely good to know. Thank you so much for our wonderful audience sending in questions for Jason as well. Thank you so much, Jason, for staying on a little while longer and answering those questions. I'd like to just say mahalo to everyone who also took the survey. And if you feel that you've benefited from this presentation, please let your friends and family know. I know the call of action went out from Lonnie to please tell 3 to 5 people that today, or at least this week. One of our friends shared it to Facebook Live. Please, that would be so wonderful to get this word out about the wonderful and supportive palliative care and hospice care programs that we have. Of course, everyone is welcome to join us on the 10th of every month at 10 a.m. Just RSVP to myself for the Zoom link, or tune in to Facebook Live. Again, that is the 10th of every month at 10 o'clock. Mahalo again for joining us, everyone. See you next month right here on Healthcare Talk Stories. Aloha.